bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
Hello and thanks for joining us. I'm Paul Lisnick and this is Comcast Newsmakers. This hour's newsmaker is Julie Hamus, State Representative for the 18th District. We're going to be talking about a superbug infection. Representative, good to see you again.
Paul.
Superbug, it sounds scary. It is scary.
It is scary.
It's actually something called MRSA, and tell our viewers about it.
MRSA is what we call it. It's really, I have to read my
It's a
cheat
mouthful,
sheet on
I
this.
know.
Methicillin-resistant Staphylococcus aureus.
We'll stay with MRSA.
Exactly. And why this is important is because it's an epidemic in Illinois right now. And really all over the country, all over the world, they are dealing with this. It's a superbug, but here's the big problem. And here's really the rub. We are getting it in hospitals. So 65–70% of what we get with this, now this is just a bacteria, but it's resistant to antibiotics. So it's very, very serious. And almost all of us know somebody who goes into a hospital for a procedure and comes out sicker. They have some kind of infection, nobody has named it.
We hear about the concept staph infection. Oh, my uncle had a staph infection.
That's right.
That's what we're talking about.
We're talking about staph infections, not all of them, but those that are resistant to antibiotics that we call MRSA are really on the increase, up 54% in the last 3 years.
Now, and in terms of numbers, people may say, all right, I may know somebody, but how big a deal is this? I mean, for example, 2006, how many cases?
Well, what we have been able to, because we forced the issue, and a group of legislators have been very tenacious about this, and we've really brought the hospitals together, we brought the public health community, we finally got a number. 11,000 hospital-acquired MRSA infections in 2006. That's a lot.
That's huge.
And what we're doing to tackle it is we are requiring hospitals, through a piece of legislation that we've introduced, we're requiring hospitals to do more and to do something very specific.
And what is it you want the hospitals
to do? Well, we want the hospitals, first of all, for everybody who comes into an intensive care unit, whether that's a children's unit or adult, to actually take a test for MRSA. Now, it's a specific kind of test. It's very easy. It's very cheap.
It's something you might come in
your
with?
nose.
Is this something a patient might come in with?
They can come in with, because there's also MRSA in the community. But usually people come into the hospital for some kind of procedure. But they could have that as coming in also. So we would, in the intensive care unit, because that's a place where people do stay a little bit longer, we would actually require the hospitals to test for it, to screen for it. It's a very simple test, as I was saying. Really, it's in a nose swab is all it is. And if they find it, we want the hospital to isolate those patients and to treat them. That seems like a very small thing to do.
Well, and hearing about it, one would think hospitals would say, absolutely, thanks for the kick on this. Are hospitals supporting this?
Well, and this is kind of a shocker. We were surprised to see that the hospitals were resisting us in doing this. Now, why is that? For the past 30 years, they have known about these staph infections that are acquired in hospitals. Remember, that's what we're talking about. And the way that they've been dealing with this, Paul, is only one way: hand washing. Encouraging,
we see those notes. Wash your hands.
Wash your hands. Employees must wash their hands before returning to work. We see that everywhere, right? Inside a hospital, people are not washing their hands enough, the hospital staff, and they're spreading it. Now, hand washing is not enough. It's a good idea if the hospitals can get every single person to do it. We salute that. Hospitals should be doing more. They ought to probably be looking at lots of ways that they're not as clean or staff resistant as they could be. Maybe, I don't know what that's all required.
Right.
We came up with one specific approach, and this approach we got from other places. The places that have tried this are doing better. The Veterans Hospital, the Veterans Administration, just in the last month, is doing this in all of their hospitals. So it's not a crazy idea, and even so, the hospital community is resisting it.
What about the Hospital Association?
They've been very helpful. I mean, I think they too understand that they have an internal struggle over this, and I salute them for sticking with us and helping us. I think they understand too that after 30 years of trying just one strategy, maybe that's not working. This is at epidemic proportions, 54% increase just in the past few years. And what I really want to say to the viewers also is that hand washing is important, and we all have to become better patients. If we're sitting in a hospital room and we're in that bed, we want us to say, "You doctor, I didn't see you wash your hands."
We expect it. Great legislation, important. Good luck in getting it through.
Thank you.
This hour's newsmaker has been Representative Julie Hamus, and I'm Paul Lisnick. And thanks for watching us here on Comcast Newsmakers. Bye-bye.
The preceding was a presentation of Comcast Newsmakers. Now back to CNN Headline News.